the access to HIV medication was difficult in Venezuela. So this is
Ower Alberto moved to Canada in 2014 so he could receive life-saving treatment.
something that caused me a lot of stress is just to pass the HIV to other folks.
Now he helps other HIV-positive folks access care in a country where government funding for HIV groups hasn't grown in decades. Canada's oldest, the AIDS Committee of Toronto, will close down in March after 42 years of public education and handing out condoms.
ACT has been in a deficit budget for over 5 years, and it came to a point where our deficit budgets were no longer going to be sustainable.
Despite an uptick in new HIV infections in 2023, this expert says Canada has all the tools it needs to control the virus domestically. He says prevention is key. Drugs like PrEP, which people can take daily to protect themselves, now have injectable options taken once every few months.
Canada is doing pretty good, but we don't live in a vacuum. Okay? We're living in an era now where the carpet has been pulled out from underneath us from a global standpoint.
The United States, which accounted for 3/4 of global HIV funding, cut it off completely earlier this year.
Clinics closed without warning, and life-saving testing, treatment, and prevention services experienced widespread and continuing disruption.
Countries like Canada have committed to the UN goal of eradicating HIV as a public health crisis by 2030.
And yet, unfortunately, most of the G7 countries, including Canada, have decided to roll back their funding.
For many, that UN goal feels further out of reach.
I don't feel confident at all. And I think we're going to see like a high rise of new infections of HIV.
Philippe de Montigny, CBC News, Toronto.